All right, today we have a fun video in store for you. We're going to talk about the psychology of beauty from the perspective as a provider in the aesthetic industry. All right, so believe it or not, when it comes to beauty, beauty is a very subjective thing, and it differs from one person to the next. I took a class once in my undergraduate years where I did a head and neck anatomy class. Shout out to Dr. Spencer. That was a fantastic course. I still use everything I've learned from that course to this day, every day. So got to give a shout out to Dr. Spencer for that one. But Dr. Spencer every week would bring in a new expert. And one of the experts he brought in was an expert on beauty. And I still remember a lot of it. And he showed slides through history of what we thought of beautiful people. And obviously, because men are mostly stimulated by beauty, he focused on the female form. And he started off in ancient Greece, and he showed a statue of Helen, or what the Greeks perceived of this mythical Helen, Helen and Troy and all that kind of stuff. And they had a statue of Helen. Helen was probably a B cup, it was a nude, and probably a size 16 with really short curly hair. And that was that epitomized beauty in the Greek form. Now, fast forward to 2024, which is when we're doing this video. What's a beautiful woman? Thin, big breast, small hips, really distinguished features, maybe high cheekbones, lots of shadow under the cheeks, almond eyes that slant down. We think of this as beautiful now. And between Greece and here, there's been a lot of changes. In medieval Europe, during the Victorian or before the Victorian area, in the Elizabethan area, is that what it's called? I don't know. But during the reign of Queen Elizabeth, have you ever looked at photos of Queen Elizabeth? What did they do? She has this huge forehead, right? The hair went to the top of their head. What would they do? They would go in and pluck the hair. They thought big foreheads on women was attractive. So Elizabeth always plucked her hair. All the women back in the medieval Europe times, they'd pluck their hair and have these huge foreheads. That was considered beautiful, right? So beauty is in the eye of beholder. Go look at all the ancient artwork, what they would think was a pretty picture. So now we're in the modern era. What is beauty? They've actually done a lot of science on this. And we have found that beauty is about symmetry and distractions. So what do I mean by that? We want a symmetrical face where we focus on the eyes. Anybody that you focus on the eyes, you tend to think is a beautiful person. Okay, so we want a symmetrical face with that help us line up with somebody's eyes. What else do we want? We want that face free of distractions. So what do I mean by distractions? Remember that old Austin Powers movie where he has that mole, that bad guy has the mole on his face, and Austin Powers is like, mole, 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 right? Because that mole was just so exaggerated and he couldn't not stop looking at that mole. Well, that would be a distraction. Another example of a distraction, somebody with stroke, where their face is sagging, or hair where it's not supposed to be, or lines, like heavy wrinkles and lines. Those could be distractions. So those are the things we want to minimize. So when somebody comes in for a cosmetic consult and they're like, I want to feel prettier, what does that consult look like? In my mind, I'm thinking, I want to maximize symmetry and I want to minimize distractions. And if I can do those two things, this person I'm talking to will objectively or subjectively become more beautiful. All right. So that's a little foundation on what beauty is. Now let's get into the psychology of beauty. There's a part of your brain called the amygdala. The amygdala is one of the things it does is fear, and it also helps you recognize things in your environment. So what do I mean by that? Have you ever bought a new car and you're driving your new car off the lot? And as soon as you get off the lot, you notice at the next interstate, oh my gosh, this guy has the same car I just bought. And then 2 miles down the road, oh, there's another car. Everybody's driving my car. Does that mean everybody that day went out and bought your car? No, it just means your brain wasn't programmed to notice it, right? But as soon as you're like getting your new car, now everywhere you see your car, it's going to pop up. It's in front of mind. Okay. And that's the amygdala playing with you. And the amygdala is designed to notice things like, for instance, we're a caveman. We notice bright red things. Why? Because that's typically a berry. Or we remember that last time we were behind this bush, there was a bear behind there and it scared the crud out of us and almost ate us. So we're going to avoid, every time we see that bush, we're going to remember, hey, There might be a bear behind that bush, right? That's what the amygdala is programmed for, to notice things. So why am I pointing out the amygdala? When somebody comes in for an aesthetic consult, the last thing you want to do is point out an imperfection that you see that they do not. Because once it's pointed out, they're never going to unsee it. And you just gave them a little bit of a syndrome, right? So whenever somebody comes in, the first thing I'll say is, what are the things that bother you, and rank them from highest bothering to the lowest bothering. And we'll go from head to toe, okay? And then they'll start pointing things out. I hate my crow's feet. Or my skin, I don't like how lax my skin is. Or I'm feeling old. Well, you might have to get some better questions. Like, okay, well, why are you feeling old? I got these bags under my eyes. Or I got these age spots, or this or this or that and that. Now, if they mention all this stuff and you're noticing they have really thin lips, but they never even brought up their lips, are you going to mention, oh, by the way, I think you have thin lips? Hell no, because you're going to give them a complex, right? And oftentimes patients will say, well, what do you think? What do you think I need? Do not fall into that trap, right? When somebody asks me, what do you think? I say, well, let's talk about what bothers you first. And then I avoid answering that question. Or I'll just reiterate what they say. Yeah, I can see those lines. Yeah, we have some solutions to those, right? So never point out an imperfection on a patient unless you think that imperfection is causing their primary source. So what do I mean by that? Let's say somebody has really puffy under eyes. They also have no cheekbones, okay? And they're very flat face. And you know, if I can build up the cheekbone, it's going to help diminish the bagginess underneath their eyes. Well, then in that circumstance, I would say, hey, listen, you mentioned that you have bags underneath your eyes. You also mentioned you didn't like these nasolabial folds, right? If I put filler here on your cheeks, which you did not mention, not only am I supporting your cheeks, but I'm also going to address these other two things. In those circumstances, it's okay, because you're addressing the other two things. You're going to do the treatment to address those other things, and they're going to be much better off as a result of that. So I will say some things of that nature. If they really drive hard, like you tell me what I need, then I just go to general skin. Hey, you know what? Everybody at your age, we should start thinking about what we can do to improve our skin. It helps everybody. Nobody's going to be offended that you mentioned that their skin could use a little bit of improvement, because everybody's can. Like, let's get some collagenesis going. Let's get that skin remodeling. Let's do some microneedling or some opus or a CO2 laser or something like that to get your skin where you want it to be. Okay. So that goes back to the psychology. You don't want to give people complexes. All right. So now let's talk about assessing the patient for symmetry. How do you assess a patient for symmetry? Well, there's a lot of science behind that. We typically break down symmetry into top to bottom symmetry and left to right symmetry on the face. All right. And the more symmetrical face, the more beautiful we want. We want a positive canthus to the eyes. What does that mean? On the eye, you have two canthus. You have a medial canthus and a lateral canthus. Okay. And if you draw a line between the corners of those eyes, or the canthus of the eyes, you should have a downward slope. That's optimal. It's really hard to fix though. If they have an upward slope, that's a really hard one to fix. You can probably support the cheekbone. You might be able to put a little tox up there to try to pull that eye, the corners of the eyes up a little bit. But that's the first thing I look for. Am I dealing with a positive canthus or a negative canthus or a neutral canthus to the eyes? Okay, positive would be optimal. Then we break the face down from top to bottom into thirds, and from left to right into fifths. The top third of your face should be from hairline to the brow. The middle third should be from the brow to the tip of the nose, and the bottom third should be from the tip of the nose to the chin. And if from top to bottom, each of those sections are equal, they would have a symmetrical face from top to bottom. Let's say you have somebody with really high eyebrows, okay, and it makes their forehead look smaller. It would also make their nose look a lot longer. So how would you fix that? Put a little tox in the forehead, bring the eyebrows down, and now you've got that symmetry. So I'm always thinking about symmetry when it comes to like tox treatments and filler treatments and things of that nature. Left to right, what is a symmetrical? The distance between the eyes should be the width of the eye. So that's your middle fifth. Then you got another fifth right here, which is the width of the eye. And then the face should extend another fifth outside of the eye. So if you draw that imaginary fifth on the outside, you should have a cheekbone there or an ear protrusion or something like that to give you that fifth. A lot of times that lateral 1/5 is really sunken in because they didn't have craniofacial development as a child, or they have a really narrow maxilla, which brings everything in. and then you need to widen that out with filler. So you put a little filler right on the cheekbone, take that fifth out, help with the symmetry. Okay. I can't tell you how many patients I've had come in where they will have perfect symmetry on one side of the face and the other side of their face is not symmetrical because maybe they always sleep on the right side and they push against the bone on the right side and the left side's bigger and the right side's not. That's an easy fix with filler. Okay. Filler is the best way of getting to symmetry. So my goal, minimize distractions. What are the distractions? Lines, tox. Think about all the forehead lines and lateral canthal lines and things of that nature. That's what tox is for. Saggingness, filler, do a little lift. You can also go in with a little kybella and dissolve some fat, get rid of that distraction. Nasolabial folds, filler. Marionette lines, filler. All of these distractions. Smoker lines, perioral lines. Go in there with a little Bellatero or a little Redensity and just fill in all those little lines around their mouth. We're minimizing distractions. So toxin filler to minimize distractions, toxin filler to help with symmetry, and you're going to make your person a little bit more subjectively and objectively more beautiful. So that's a quick little video on beauty, how it evolved, where it got to today, and what you should be looking for when you're doing an assessment with your patients. Hope you learned a few things. Like and subscribe. Keep following us, support our page, and we're going to keep creating more content to help you get you where you want to be.